Welcome, students. Today we are going to cover slides 71 through 100 for your week number 2 in Module 106. So getting started here, we are starting to look at immunologic testing. And we were just looking at certain assay testing. So this is kind of just continuing on with that topic. Now, immunoassays are tests that use antibody and or antigen reactions to produce results. And I'm going to go over the next few slides what these types of tests are, what they look like, and then I'll also be showing two separate videos of I have a monoclonal antibody test that I'm going to show you and an ELISA test, which again, both of these are, but also it's ICT as well. So I'm going to show you a few different assay methods that we use for, again, this is antibody and or antigen testing. To figure out if they are positive for certain health conditions. So I'm going to show you a video here about FELV, FIV testing. That's feline leukemia and feline immunodeficiency virus. And then I'm also going to show you a 4DX test, which tests for certain types of internal parasites and heartworm. Now, when we run these tests, we do have to typically we use a whole blood sample. This would be whole anticoagulated blood. As a reminder, anti means to go against or without, and coagulated is talking about clotted. So if it's anti-clotted, that means that it is not going to be clotted blood. So we'll use typically a lavender top, which is an EDTA anticoagulant additive. If we're using whole blood, we could also spin down the blood and use a serum or a plasma sample to run these tests. Now, again, ELISA, this is enzyme-linked immunosorbent assays. So I'm going to show you the IDEX snap test of the ELISA, and then I'm also going to show you an immunochromatography or an ICT assay method. And both of these tests, they can test for the same exact things. It's just different ways to run the test. And it's honestly, it's different manufacturers. So like IDEX, they use ELISA. Other manufacturers, they don't use the same exact testing methods, and so forward. But that doesn't mean that we can't still get the same results and that it's still the same test. It's just a different way to run that test. And it's very easy to do. So again, ELISA, that's going to be one of the most common ones in veterinary medicine. We call them SNAP tests. You've probably heard of your lab instructor talking about them. These tests have a solid phase. And don't worry, I'll show you some pictures here. This is a ELISA SNAP test that you're seeing here, the IDEX test. This test has a microwell, a wand, a flow-through membrane, and a chromatographic strip, and that's how we read those results. In conjunction with this plastic test mechanism that we're using, we're also going to use a conjugate reagent. This is a solution that will embed in the solid phase, and it's usually monoclonal antibodies. So this is what reacts with the blood to then give that color producing change for the test results. So we drop the blood and the conjugate into the well here. It goes across that test membrane, and then you'll always have a control. So whether it's a control line, as you can see here, C is control, or it's like the center dot here, that's the control line for this test, for the SNAP test. So you're always going to have the control. And then, of course, if other colors pop up through those other testings, again, depending on how many things we're testing for, FELV, FIV, you're going to see two other dots possibly show up, and that would mean they were positive. For this one over here, they just use the same thing, but it's lines. Again, they always have a control line versus then the test line that would only pop up if they were positive. It's the same exact thing for like a 4DX. And again, this is testing for different types of Ehrlichia and also heartworm testing. So I am going to show you all some videos here. The first video is using a witness test,
In this
which is an,
spectral
which is an ICT type test. And then the next one is using that 4DX, the IDEX snap test.
And it's incredible.
All right. So let me get this shared here and we'll watch first the witness test and then we'll look at the IDEX version. And they're both really simple. They only take a few minutes to run. Again, we only need a few drops of blood. and a few drops of conjugate and a few minutes to run the test, and we get the results really quickly. We do these all the time standard with your wellness visits, especially like new puppy, new kitten exams, um, even yearly exams, especially if the patients are at risk of getting especially heart disease. We do heart disease tests on dogs pretty much at every annual. All right, we'll get started first with the FELV FIV witness test.
Video, we demonstrate how to use a witness feline leukemia, FELV, and feline immunodeficiency virus, FIV test by Zoetis. While these two infectious diseases are relatively rare in cats, they can dramatically affect the prognosis of the feline patient. Feline leukemia is a highly infectious retrovirus that is transmitted by contact, such as licking, aerosol spread, biting, placental transfer, etc. Clinical signs from FELV include the development of leukemia, lymphoma, anemia, and immunosuppression. The prognosis for feline leukemia is poor. The diagnosis of feline leukemia is based on detection of protein P27, a viral antigen. Feline immunodeficiency virus, or FIV, is also a highly infectious lentivirus and can result in the clinical syndrome of immunosuppression. The prevalence of FIV is reported to be 1 to 20%, depending on the geographical location. FIV is also transmitted by contact, such as licking and biting. Other clinical syndromes include lymphadenopathy, anemia, neurologic disorders, opportunistic infections or tumors, stomatitis, and gastroenteritis. The prognosis for FIV is generally considered to be much better as compared to feline leukemia, as cats can live with the disease for years. The diagnosis of FIV infection is based on the presence of anti-GP40 antibodies. To use the witness FELV FIV test, only 1 drop, or 0.05 mils, of plasma, serum, or anticoagulated blood, in other words, blood that has been collected in an EDTA or heparin tube, is necessary. This test is different from other companies that use ELISA, as it utilizes RIM, rapid immunomigration technology. Results are available within 10 minutes and are easy to interpret in the results window for feline leukemia and FIV. Keep in mind that any, quote, ADR or ain't doing right cat with an unknown feline leukemia or feline immunodeficiency virus status should be tested, as a positive diagnosis may affect a pet owner's desire to treat based on the prognosis.
Okay, that was the first video. Now we're going to go into the second one here, which is the 4DX snap test using the IDEX ELISA test.
Hello, so I'm going to give you a brief overview of the 4DX snap test. So we've got our sample here, we've got some blood from our patient, a little test tube, and the conjugate, the solution that is important. So we're going to add 3 drops of blood, 4 drops of conjugate, and then we're going to pour it in our test kit and let it do its job and see what the results are. So in here we have the snap test itself and some desiccant to keep it nice and dry, and a little pipette. So we've got our sample. So we've got 1, 2, 3 drops of sample. And then we've got 1, 2, 3, 4 drops of conjugate. Put the lid on there, mix it back and forth, and now we're ready to do the test. So yeah, we've got the 5 dots on this test. This one in this corner is the positive control, so it's gonna light up if the test worked, and these other 4 are looking for the 4 diseases, and so they'll only light up if the patient tests positive, so for one of those things. So And it's incredible because we have incredibly advanced technology that is incredibly simple to use. It's the most fascinating thing. We're gonna pour our sample in there. And we're gonna wait. And that sample is gonna get sucked up, drawn up across the window there. And once it covers the entire window and shows up in that little circle there, then we'll snap it. And that's when that test really lives up to its name. Oh, I can see a little bit coming into that big window there, so there's the snap, and that lets a washing solution out, and it's gonna wash that blood away, and it's gonna turn up white, and I'm gonna hit the timer and we wait 8 minutes. So we're almost done the timer here. There we go. So time's up. So now we take a look at this test here. And we're running good news. So the positive control has lit up. That's that blue dot up in the corner. So the positive control means that we can be confident that the test worked. And the 4 spots where we would look for a positive test for the diseases, they're all negative. So we're negative for Lyme disease, negative for heartworm disease, negative for anaplasma, and negative for Ehrlichia. And in our area, heartworm and Lyme are the 2 that would be the most common ones we'd worry about. So yes, we're happy. Thanks for watching this video about the 4DX snap test.
All right, perfect. So now everyone has gotten to get some visuals of what those tests look like and running them in the general practice clinic. Again, those are something that we run all the time with annual exams. You'll see them very commonly done. You'll do them every single day, multiple times a day. So with that being said, we're gonna move forward with our slides here. This is just a image here that talks about the antibodies, the enzyme conjugate, and again, how that will make those reactions in order to see those results on that SNAP test. So now we're going to move forward and we're going to talk about some more immunologic testings. The first one that's listed here is immunochromatography, which is ICT. This is lateral flow assays. Again, they're similar to ELISA. That's what I've already showed you, that have that chromatographic strip, the conjugate, and the flow solution. So that was just that first test that I showed you. Very similar. We can test for the exact same things. It's just different testing methods. And the tests are super similar. Pretty much the same steps, except for the only difference is the snap ones, you actually push down and snap it to start the test. Now, another test that we're going to look at, this is agglutination. This test will detect antibodies to large particulate antigens. And specific antigens are added to the test sample, and agglutination will occur if the sample contains specific antibodies. Now, the first video that's listed here, it's a crash course video about the blood. So we will take a look at that, and then I will also show you the saline agglutination test. These tests will test for brucellosis in dogs, also for blood typing. We use it for mastitis, rheumatoid factor. There's many reasons why we can use them. So we will go into, again, both of the video links here to just give you more visuals. You'll notice we do that a few times here throughout this lecture, again, just so that you can really get the visual and understand what those tests are and how we're going to be running those. Okay, so let me pull up the crash course video here. We'll go through this talking about the blood, little crash course video. I absolutely love crash course. These are great videos. I use them quite a bit for the especially module 101, which is your anatomy, physiology, and terminology module. So you'll definitely see this channel pop up quite a bit throughout your module. So we'll watch this quickly, and then we'll get into, again, performing this the saline agglutination test.
Don't take this the wrong way, but you're pretty replaceable. When it comes to your body, science has figured out how to hack, synthesize, or replace a surprising amount of its parts and processes. We have implants to keep heartbeats steady and steel rods to mimic bones. We've got drugs that can replace hormones and antibiotics to cover for your immune system. And pretty soon, you'll be able to just 3D print a new ear if you need one. Really. But one thing we absolutely cannot manufacture, despite what True Blood would have you believe, is blood. And yet blood is a thing that we all need. And sometimes, because of injury or illness, we need extra blood. In fact, every 2 seconds, someone in the US needs a blood transfusion. This could be a victim of a car accident, someone undergoing surgery, or a cancer patient who needs new blood to maintain their health during chemotherapy. And because we can't grow it on trees or make it in a lab or even store it for all that long, the blood that people need, nearly 16 million pints a year in the US, has to come from people who have donated it. So, let's talk blood, shall we? The meal of choice for vampires and female mosquitoes, blood is red, sticky, salty, and kind of metallic tasting. It is indeed thicker than water and super viscous, which is why Hitchcock used chocolate syrup as a stand-in a certain classic shower scene. For most purposes, blood comes in 8 different types, and it accounts for about 8% of your body weight. You might remember from our episodes on tissues that blood is a type of connective tissue, which means it's made of living cells suspended in a non-living matrix, which in this case is the fluid ground substance called plasma. And of course, one of blood's main missions is to transport and distribute oxygen and nutrients and waste products and hormones around the body. But it also helps maintain and regulate body temperature, pH levels, and the volume of fluids in your body. Plus, it protects you from infection and from the loss of blood itself. Perhaps second only to your brain, your blood is the one component of your body that we haven't figured out how to reproduce, synthesize, or imitate. It's a part of you that is literally irreplaceable. It's Saturday and you feel like doing a good deed, so you head over to your local Red Cross for a blood drive. You get your finger pricked and then somebody directs you toward a lounge chair, swabs your inner elbow with alcohol, and then comes at you with a hollow needle. Once the bag is full, they usually take about a pint, you get unhooked and grab a cookie and a juice to replace the blood sugar you lost, and the whole process takes around 20 minutes. But for your blood, the day is just beginning. Soon it will be taken to a lab where it'll be tested for infectious diseases and separated into different parts before heading out to hospitals. So hold up. What exactly do I mean by different parts? Well, the blood that flows from your arm into that bag is whole blood, a mixture of cells and cell fragments called formed elements along with water and lots of dissolved molecules. A patient who needs a transfusion may only need some of those things and not others, so the parts are separated. Once your blood makes it to a lab, technicians put it in a centrifuge which spins it around fast enough to send the heavier components to the bottom of the tubes and bring the less dense elements to the top. In the centrifuge, 3 distinct layers emerge. Down at the bottom, you got a heavy red layer of erythrocytes, or red blood cells that carry oxygen and carbon dioxide. They make up about 45% of your total blood volume. Then you got this thin little whitish layer in the middle. Those are your warriors, the leukocytes, or white blood cells that defend your body from toxins and foreign microbes. And there are also the cell fragments called platelets, which help with blood clotting and make up less than 1% of your blood. Finally, up at the top, you see the yellowish plasma, which accounts for about 55% of your blood volume. Plasma is actually 90% water, but the other 10% is chock full of 100 different solutes, including proteins, electrolytes, gases, hormones, and waste products. The most abundant of these solutes are electrolytes, which you may have heard of as the secret ingredient in sports drinks, but they're really just positively charged cations like calcium, sodium, and potassium, and negatively charged anions like phosphate, sulfate, and bicarbonate. Together, these ions help regulate your blood's chemistry, maintaining its pH levels and proper osmotic pressure, and allowing other tissues to do their jobs, like making muscles contract and sending action potentials. But when measured by weight, the bulk of the solutes in your blood are really the plasma proteins. Most of these proteins, like albumin and alpha and beta globulins, are made by the liver and do things like balance the osmotic pressure between the blood and surrounding tissues and transport lipids and ions. Others run defense for you, like the gamma globulin antibodies that are released by plasma cells during an immune response, or fibrinogen proteins, which are vital to forming blood clots and stopping bleeding. Alright, bleeding. I want to talk about that. Because for the very reason that I mentioned at the beginning, that we can't replace your blood with some synthetic wonder fluid, the last thing that your circulatory system wants is for you to fritter away your blood in some sidewalk scrape or kitchen accident. So it has a whole system in place to prevent you from losing too much of it through a process known as hemostasis. So imagine you're slicing up a nice garlic cheese bagel one morning and you lacerate the distal phalanx of your pollex. In other words, you cut the tip of your thumb. And now you're bleeding all over your breakfast. At the very first sign of rupture, the blood vessel actually constricts itself to slow the flow of blood through it. Then little cell fragments called platelets gather at the site of the injury, creating a plug that dams the breach and keeps the blood from leaking further. Now, these free-floating platelets don't clump together during regular circulation. That would be terrible. But when the endothelial cells lining a blood vessel wall tear, the underlying collagen fibers are suddenly exposed, and they chemically react with the platelets, turning them all sticky and glue-like at the scene of the injury. But that platelet plug still isn't as strong as it could be. It needs reinforcement to complete the clotting process. This reinforcement comes in the form of fibrin threads, protein strands that join together to make a sort of mesh that traps the platelets and blood cells. Eventually, the threads actually pull the opposite sides of the wound together to close the vessel wall so the endothelial cells can be replaced. Over a few days, the blood vessel heals and the blood clot dissolves, or at least that's how it's supposed to happen. People who suffer from disorders related to hemostasis may have trouble with unwanted clotting or the inability to form clots. In the family of disorders known as hemophilia, a patient can usually complete the first two steps of hemostasis just fine, but they can't make an effective fibrin clot. So it's not that they bleed more than anyone else, it's just that they bleed longer, which I guess means that they bleed more. As a result, they may need frequent blood transfusions throughout their lifetime. Which brings me right back around to that Saturday morning blood drive. Another thing you're gonna need to know before you give blood is what type you have. Do you have A, B, AB, or O? These different types all do the job equally well, they just sort of have a different flavor related to your immune system. All the cells in your body have a plasma membrane with specialized glycoprotein markers on them that act like name tags or labels, sort of like, this cell is property of Hank. These markers are your antigens. And your body's immune system is totally fine with your particular antigens, but if it detects antigens from someone else's cells, including viruses or bacteria, then it'll send out antibodies to bind to those markers, often to tag them for destruction by the immune system. Your red blood cells have specialized antigens on them called agglutinogens that activate antibodies that work by binding invading cells to each other, which causes coagulation, or the clumping of blood. Which agglutinogens you have on your erythrocytes defines your blood type, but they're classified in two different ways. In the most important blood classification, the kind people are most familiar with, there are only two kinds of agglutinogens, simply A and B, and your blood can either have one, or both, or neither of these molecules. So the name of your blood type refers to what kind of agglutinogens you have or don't have. A type has A antigens, B type has B, AB has both, and O has neither. So why do you need to know what type you are before you give or receive blood? Well, like I mentioned, if you have either of these antigens, your body will be fine with it because it doesn't produce any antibodies that label it for attack. So if you don't have a particular antigen on your blood cells, say the type B, then you do have antibodies that are going to label those B antigens for attack should they enter your space. So AB type folks are called universal recipients because they have both antigens and therefore no antibodies for either. So they can accept A or B or AB or O blood. Meanwhile, O type doesn't have A or B antigens, so those folks have antibodies for both. That means that they can only accept other O blood. And yet that lack of antigens means that type O blood can mix with other types of blood without getting attacked, which is why it's known as the universal donor. But just to complicate things a little bit more, you've got a whole other set of antigens with totally different protocol. These are your rhesus, or Rh antigens, named after the species of monkey they were first identified in. Much like A and B, you either have the Rh antigens, in which case you're Rh positive, or you don't and are Rh negative. Most of the population is Rh positive, so they don't have the anti-Rh antibodies, which means they can accept either positive or negative blood, but negative types should stick to just the Rh negative blood. And since the presence of AB antigens is controlled by different genes than the Rh ones, we end up with 8 different blood types, 4 separate groups, each with 2 variations. And now, hopefully, you understand why it's so hard to replace blood, and why true blood is not true. I've not actually ever seen that show. Along the way, you also learn the basic components of blood, including erythrocytes, leukocytes, platelets, and plasma, as well as the basic process of hemostasis that stops bleeding, and how antigens are responsible for the blood type that you have. Thanks to all of our Patreon patrons who make Crash Course possible through their monthly contributions. If you like Crash Course and want to help us keep making it for free for everyone in the world, you can go to patreon.com/crashcourse. Also,
All right. Absolutely love Crash Course. There's such great videos, so much information packed into, typically 10 to 15-minute long videos. You'll see them pop up quite a bit throughout your courses in the module. So now that you know a little bit more about the blood, a little bit more in depth, kind of a little bit of a crash course from last week, as we went over it, now I'm going to show you that saline agglutination test, for the immunologic testing before we get into our next topic here. This is another great channel. It's called @Dove on YouTube. They're fantastic. I also use them quite often in the courses.
Hi, I'm Megan. Today we're going to do a saline agglutination test. In cases of immune-mediated hemolytic anemia, the body actually coats its red blood cells with antibodies, and then the red blood cells end up sticking together. This can cause big problems further down the road as far as inappropriate clotting. And it's an easy way for us to kind of the first step in diagnosing an immune-mediated disease. So it's very simple to do. You just need anticoagulated blood. So make sure that it's not fresh blood that you've just drawn from the animal without putting it in a tube, because you won't be able to tell the difference between clotting and agglutinating. So draw the blood, put it into a blood tube so it's anticoagulated to do your test. And then you just need some saline and a microscope slide. So I'm going to start here with my anticoagulated blood. And I'm just going to draw out a small amount and put a drop on my slide. Next, I'm going to draw a small amount of saline and then put a drop of saline on the slide. Next, I'm just going to take the slide and kind of rotate it back and forth to kind of mix everything up. The reason for the saline is that it can be difficult to tell the difference between rouleau and autoagglutination. If you see kind of a sandy appearance within your smear here, and if you start to see cells clumping up, rouleau and autoagglutination will look very similar macroscopically. So the reason we put the saline on there, if it's rouleau, where cells are just kind of stacked on top of each other, we can see rouleau because of dehydration, and in some patients it may be normal for them. The saline is going to help separate that out. If the animal is truly autoagglutinating, the saline is not going to break up that autoagglutination. So I'm kind of rotating my slide here a little bit. I can actually see, some clumping on here. So I'm assuming this is going to be a positive saline agglutination test, but always want to check it under the microscope. So I'm going to do this under 10 power, and what I like to do is just find a spot kind of towards the edge of the slide. You want to make sure that you're looking at a monolayer of cells, and what you're looking for is cells clumped together like grapes. I'll kind of get in here and take a look at this. So again, rouleau is going to look like cells stacked on top of each other, like if you were to take coins and stack them up. And autoagglutination is going to look like kind of clusters of grapes. So it's unorganized, just bunches of cells together. And in this case, I definitely see autoagglutination. Looking through the rest of the slide, I don't see any rouleau. If I did see both, I'm going to put a little bit more saline on this and check again, but that's how you do a saline agglutination test.
Alrighty, students. So that was some good visuals there of that saline agglutination test, and again, videos there about the blood. So now we're going to get back into our slides, and we're going to start to talk about intradermal skin testing. So we've got some visuals here of some dogs that unfortunately have some skin conditions going on. Now, there's many different reasons for skin conditions, especially with alopecia, which is a term for hair loss. So this can be caused by mange. And there are several types of mange. There's actually an entire parasitology lecture. It's in your supplemental section here in Module 106 under the lecture tab. And it goes over the different types of mange, and actually the mites that are involved in mange, and again, signs, symptoms. So I highly recommend that you go and take a look at that supplemental lecture for more information about it. But mange or hair loss doesn't exactly mean mange. It can also be due to an overproduction of yeast or candida. It can also be a fungal infection on the skin. It can also be bacterial, and it can be allergies. Patients can be allergic to many different things, such as like food, environmental, even certain stress factors can cause hair issues. And a really big one is genetics. There are certain dog breeds that are more prone to allergies than others. For example, one of the main uh, breeds of dogs that I see with skin issues are bully breeds. So I'm talking about our bulldogs, our pit bulls. Absolutely, I've seen those breeds with more skin issues than any other breed. So genetics absolutely do play a really big role, especially in allergies. That being said, we're going to talk about a few different testings that we can do for allergies and if they're suspected. So the first one here, it's called intradermal skin testing. And this is when the patient will be referred to a dermatologist. We don't do this in general practice clinic, and it will be a skin window test where we shave a window of hair off of the patient, a little square as you can see here, and we will then mark the skin with a skin marker and inject intradermally skin allergens or common allergens that we see. So these are intradermal antigens. Now, as you can see here, some of these marks have no redness. Other ones have red welts. So those red welts that you see are indicative of an allergic reaction. Now, this is a type of testing, again, that they only do in specialty. You're not going to do this in general practice. In general practice, the type of allergy testings that we can offer is skin scrapes. And we're going to talk about skin scraping as well. So we can do skin scrapes, we can do tape impressions, we can do skin impression test. So I will show you guys a few videos about those as well. But again, when we're trying to diagnose allergic skin diseases, our first line of testing is going to be the skin scraping, the skin in tape impressions, or even just skin impressions. Those can be done with a glass slide where we take some of the skin cells off of the patient, we put it on that slide, and we look at it under the scope to see what kind of cells are present. It's not going to tell us what's the actually causing the. Oh, can you guys see the slides on my screen? I see one student that said they couldn't. Can I get a few more students in the chat? Can you guys see the slides? No? Okay. Super important you all let me know that if for some reason something gets funny like that. Okay, no worries. Let me reshare. We're gonna stop and reshare. Okay, let's try that one more time. All right. Can we see slides now? Yes, looking at slides. Beautiful. Okay, awesome. All right. So let's get back into that. So we were just looking at, again, this is some skin conditions here with the patients. So this is what I was trying to show you with the visuals. So this patient here, these patients, as you can see, have hair loss, redness, absolutely can be indicative of some kind of skin condition, whether that's yeast, bacterial, fungus. There's many different causes for that. Now, again, we can do this intradermal skin testing, and that can test for a lot of different allergic skin diseases if they're actually allergic to something, which would be like food, contact dermatitis, insect bites, inhalants, atopy, environmental. And that's when we would shave this window here and we would inject allergens into where it's marked on the skin. And again, if there's a reaction, you'll see that come up with these welts. If there's no reaction, as you can see, there is no welts present, and that means that they wouldn't be allergic to those antigens. Now, this is something that a dermatologist would do, so not your primary care veterinarian. It would be a specialty veterinarian that would do this type of testing. And intradermal injections are into the dermal layers. So they use a very small needle and syringe. It's typically an insulin needle and syringe. The needle is very small, typically a size 28 gauge needle, very, very tiny, and it just goes barely underneath the skin because it has to go in between those dermal layers. It's not puncturing all this way through like a subcutaneous injection. Again, prior to doing specialized testing like that, we typically do a skin scrape or a skin impression or a tape impression, and this is to determine what's causing it. Is this bacteria? Is it yeast? Is it fungi? Or is it more than likely inflammation because of an allergic reaction? We would only go forward with the intradermal skin testing if it's not bacteria or yeast or fungus, if it's actually something that's probably causing allergic reaction. Because if it's just bacteria, yeast, or fungi, we can treat that with medication and they'll get better very quickly. And we don't have to go any further. It's probably not allergies. Now, if we didn't want to do the intradermal skin testing, we actually do have certain blood tests that we can do for allergies. However, it's really expensive. I mean, so is going to a specialist and doing this type of testing as well. The blood test is typically, it's got to be more than $1,000 now. I mean, when I was in the field a few years ago, it was upwards of $1,000. I'm sure it's probably increased now with today's times. And we need about 20 cc's of blood. So it's not ideal if we're doing this on like a chihuahua or a small cat. Really tiny patients, we can't take that much blood. It wouldn't be probable for them. So we have to look at again, if it is allergies, what would be the best route? And although blood test is possible, it's not always super reliable. The intradermal skin testing is actually a lot more reliable with the results and tends to yield more accurate results. So I'm going to show you a video about the intradermal skin testing so that you can get an idea of what that looks like. And then I'm also going to show you a video about skin scrapes, which is what we'll do again to determine if it's yeast, bacteria, or fungi that's present. So let me just pull up those videos here. All right, so we're going to watch again a intradermal injection first, and then the skin scraping and such thereafter.
Intradermal skin testing is just one of the ways we can determine which allergens are significant in a case of atopic dermatitis. The purpose of this test is to decide which allergens to use in allergen-specific immunotherapy, which is one way of trying to control this disease. The first injection is the positive histamine control. This produces a red raised wheal at the injection site. The second injection is the negative control, and this is the saline in which the allergens are suspended in. At the remaining sites, we inject individual allergens such as house dust mites, forage and storage mites, grass, tree and weed pollens, and various molds. A positive reaction produces an inflammatory wheal similar to that of the positive control. This develops within 15 minutes. It is very important that this test is not performed until all other causes of the animal's itchy skin condition have been eliminated. This is due to the incidence of false positives which can occur occasionally with this test. Diseases such as food allergy, scabies, and flea allergy all have to be ruled out, as do other external parasites and yeast and bacterial infections, as these can all contribute to an itchy skin condition. Here we see the results of the intradermal skin test in this dog. On the left there is the positive histamine control. At the fifth site along is the positive reaction to the house dust mite Dermatophagoides farini. And further along there are positive reactions to 3 different species of forage and storage mites. These mites can be found in house dust and can also be occasionally found in sacks of dried dog food which have been left open for a very long time. Further down, there is a positive reaction to Malassezia. This is a yeast that's present in dogs' ears and can also cause problems in dog skin affected with atopic dermatitis. Allergy to this yeast will exacerbate an already quite itchy skin condition. Here is another dog that has had an intradermal skin test, and this dog is allergic to some pollens as well as house dust mites. With the results of the intradermal skin test, we can formulate a vaccine to use in allergen-specific immunotherapy. allergen-specific immunotherapy can improve the symptoms of atopy by at least 50% in about 75% of cases. Allergen-specific immunotherapy can be given either by injection, with maintenance injections of once a month, or by sublingual immunotherapy, which is given twice a day, every day, under the tongue. Here is a photograph of a young German Shepherd dog that has suffered with atopic dermatitis for several months. The inflammation had resulted in thickening of the skin and hyperpigmentation, and the dog was very itchy. Here is a picture of the same dog 6 months later after receiving allergen-specific immunotherapy. The skin has returned to normal and the dog is no longer itchy. For more information on
All right, that was a great visual of that intradermal skin testing. And now we're going to move into really quick to show you the different types of cytology sampling. Again, this is typically what we do as a first line of defense to try to see if it's, again, bacteria, yeast, fungi, or if it's just inflammation due to an allergic reaction. And this is something that you will absolutely do. We do this in general practice, again, as our kind of first line of skin testing before we go to specialists and anything further. So we'll play this short video here, and that'll be then finishing up for the skin topics.
Okay, we're gonna do some cytology on this dog, and we have a few different tools to do that. We can use just an impression with one glass slide, or we can use the transparent tape with a glass slide, or you can use a cotton bud and then rub that on the slide. So here are the techniques that we're going to use for this interdigital cytology. So first we'll just do the impression. She has kind of a red inflamed area, so I'm going to push my finger from underneath to bring that forward and just touch it several times like that. We've got some on the slide. We'll let that dry and then go ahead and stain that with the Diff Quick stain. For the Scotch tape impression, take a short piece of tape, and I'm going to go over here to this foot where she's had some trouble. And take that foot and just press it against there a few times. And that's it. We'll put that on the slide. Loosely on the slide so that the stain can get underneath it when we put it in the Diff Quick. So those are two techniques for taking the cytology of the skin. You can also use a cotton bud. You would just do something like this, just rub it in the area, and then roll it out on the slide. All right, so that's taking skin cytology samples.
All right, so that was it for, again, some sample collection methods for cytology testing. So what we're going to do, class, is we are going to go on a quick break, and then when we come back from the break, we will resume the slides here. Welcome back from the break, students. We're going to continue on with our slides. So with our next topic here, we're now looking at antibody titers. Antibody titer tests are typically used for vaccine titers. So this is common for animals that are traveling internationally or traveling to the state of Hawaii. They would have to do a rabies titer test to determine how many antibodies are actually in the bloodstream and in the body, to make sure that they're actually vaccinated successfully against those diseases. So again, these indicate the amount of antibody present, and we do certain dilutions and concentrations. Now, there's many antibody titers. I'm giving you the example of a rabies titer because that's pretty common. And again, you'll see that with people that are traveling internationally or to Hawaii with their pets. Now, we don't do these rabies serology titers in the clinic. That's something that you have to send off to a special reference lab. And in fact, the only reference lab that does it in the United States is Kansas State University. And they'll do certain ratios of serum and saline. to determine, again, the antibody that's present. So typically they'll do like a 1 to 10 dilution or a 1 to 40 dilution. And then they'll look at the greatest dilution that tests positive as a positive titer. So if they are positive at 140, then they have passed the titer test. So the higher the positive titer, which is a more dilute solution, like the 1 to 40, means that there are more antibodies present. They've been successfully vaccinated and they have those antibodies in their system. Now, serial antibody tests during a time period can track the course of a disease as well. So we could also look at like rising titers versus falling titers. Again, we typically run this for vaccine titers. Something to keep in mind when we're collecting samples and we're running tests is that there are common errors and artifacts that can happen in immunoassays, such as our sample quality. Also, washing of that sample, if the sample has to be incubated or its storage. So it's really important to have really good handling skills. So having aseptic technique, using sterile equipment, washing or dyeing the samples when and if it is necessary. Some samples need to be incubated in warm environments, other ones need to go in the fridge. So knowing proper storage is essential to make sure that we're doing this correctly. If we mishandle it, we will get results that have errors and then they will not be accurate. We're now going to move forward to look into a little bit more about bacteria in mycology and microbiology testing. So when we are running certain cytology tests, we're typically looking for the presence of bacteria. And this could be for a blood smear, this could be on a cytology of the ear, of the skin, even vaginal cytologies. So we would be looking for different types of bacteria. And there's many different types and characteristics of bacteria. And I'll show you an image here in the next slide to give you a little bit more visual representation. There's bacilli, there's cocci, there's spirals. They can come in chains, clusters, pairs, tetrads, or palisades. And bacteria can contain cell walls, plasma membranes, ribosomes. They also can have capsules or flagella to develop endospores. It does vary, though, of course, between bacterias and the type of bacteria, and growth requirements also will vary with the species. Other factors that come into play with growth requirements for bacteria is going to be temperature, oxygen availability, and the pH level. Bacteria does reproduce by a process called binary fusion. This is the generation time, which is equivalent to the time for population to double. And again, it just varies with the species. Now, a reason why we run cytologies is because we need to understand and test for what type of bacteria is present. We can't just treat with antibiotics. There are specific antibiotics that treat specific bacteria. So if I were to give a patient, let's say cephalexin, and this is a bacteria that is resistant or non-responsive to it, I'm basically just throwing medication away. I'm medicating for no reason. So this is why we tend to do cytology testing to determine if it is bacteria or if it's yeast or fungus. And then being able to then know the appropriate antibiotic that we should use in conjunction to that bacteria that's present. Now, we typically will send a cytology off to a reference lab if we're trying to do bacteria typing, but we can at least look at it under the scope to see, again, what microorganism is present. Is it bacteria? Is it fungus? Is it yeast? On this example here, this is the shapes and arrangements of bacteria. So we have the bacilli, we have the cocci, we have the spirals, again, kind of looking like blocks, like circles, or even like squiggly lines and spirals here. They can also be in different formations, like a chain, one after another. They can be in massive clusters paired together. They can be in pairs, which is two side by side. They can be in tetrads, which is like four in a square. And then they can be in the palisades, which is could be parallel lines, it could be horizontal lines, it could be, in different formations in that sense. Now, aside from bacteria, we're now going to look at mycology, which is the study of fungi and yeast, which is also known as hermaphrodites. These are organisms that have hyphae or micella. They're also considered to be eukaryotic cells. They could be parasitic or saprophytic, and they're differentiated on a basis of hyphae structure or presence of spores. So some things to keep in mind with fungi and yeast. Again, this is where that cytology is essential. We could look at the skin and it could be red and inflamed, flaky even, and there is not really much of a way to tell what it is until you look at it at a microscopic level. So that is what we do. That's why we do the taping, the impression, the scraping, or the cytologies with those cotton-tipped applicators to then look at it on the microscope at a microscopic scale to identify what those cells look like and what is causing those symptoms in that animal. I want to remind everybody again that as an assistant, your main job is going to be obtaining the sample, handling it correctly, placing it on the scope or running it through the machine, and then giving those results to the doctor or having the doctor read the results like on the microscope. They would be the one looking at it and reading it and evaluating it. So your job is not to determine what's present or to give that diagnosis. The only person that can diagnose is the doctor. That's why they went to school for 8+ years or even longer if they're a specialist. So just something to keep in mind. We're assisting in that process. You are not actively reading results or determining any type of diagnosis, but you are assisting in the whole process. We get to run all the tests, which I think is the fun part. Now, when it comes to in-house microbiology laboratories, in a small animal practice, you're going to have a lot of different equipment, such as microscopes, refrigerators, incubators, autoclaves, culture medias, stains, things for sample collection, sample processing. You might even have antimicrobial sensitivity discs, biochemical test materials, inoculating culture medias, or inoculating dermaphrodite test medias. So a lot of different supplies, and it really just depends on your hospital and what they like to run in-house versus what they want to send out. Remember, every hospital can be different in this sense. Some general practice clinics don't have any in-house machines and they send everything out versus others have all of them and they do everything in-house. It is cheaper to run tests in-house than it is to send to reference labs typically. But it's the initial investment of buying those machines and having them um, in clinic, and also this training of the staff in order to learn how to use them, the quality control. So there's a lot that goes into making that decision of what they want versus what they don't want. But they're at a minimum going to have a microscope, lab materials, a refrigerator, an incubator, an autoclave. That's at minimum. Whether or not they decide to have other laboratory machines or do culture medias and stuff on clinic site, they'll also have stains like the triple dip stain that y'all will see in your labs to stain those slides. Again, further more advanced machines and supplies, that's going to be a case by case basis, depending on the hospital and the business and whether that's beneficial to them or not. Again, to review proper specimen collection and handling, this is very important to an assistant position. Again, this is mainly what we do is we collect the specimen and we run it through that test or we prepare it for that test. So guidelines for microbiologic specimens is to collect the specimen aseptically. So use your aseptic technique being clean and sterile. Collect an adequate amount of sample. To use separate multiple samples to prevent cross-contamination. So for example, if you were doing a cytology on the ears, you're not going to take a cotton tip applicator in the right ear and then go over and use the same one in the left ear. You're going to use new testing materials for each side. You are not going to cross-contaminate those over. You're also going to be labeling that specimen container, whether that's handwriting it or having a label printer. You need to keep the specimen cool and dry during transport. Some places use dry ice containers. Typically, though, we use the refrigerator and then the courier. Those are people who work for the reference labs that drive around to the hospitals and they pick up all the lab samples and they take them to the lab. It's typically done every single day. That's the sending it off to a reference lab by fastest means possible. It's typically through a laboratory courier. And if we have swabs like for cytologies, those are your cotton tipped applicators, we're transporting them in a medium if that is necessary. So again, realizing, do they need to be incubated? Is this refrigeration? What temperature is required for that sample in order for it not to be unproperly handled? Now, sample processing materials can include things like glass slides and cover slips. Cover slips are those little squares that go on top of your sample before you put them on the scope. Gram stains, inoculating loops and wires, Bunsen burners or alcohol lamps, and then candle jar or anaerobe jars. And be aware that with culture media, which is what we're going to talk about next, not all hospitals do culture media. In fact, a lot of them don't anymore. I would say it's a little bit more of old school medicine. Nowadays, we typically just send the cytologies off to the lab and let them handle it, because it's just a lot to have in a general practice clinic anymore, and it's just easier in that sense. So I haven't seen much of hospitals do their own culture medias. Again, they typically send those off. Now, we'll talk a little bit more about that, what that is. And if you've taken a biology class, you might not know what I'm talking about based off of the name. But as soon as I show you this image, you're going to be like, oh, yes, I remember doing that. Because you most definitely probably did that if you took a biology course in grade school or in college. Um, so we use certain culture medias. These could be solid medias for bacterial culture. We have different ones like Muller-Hinton, Matt Conkey, EMB, blood agar, which is going to be the most common one that you're going to see. That's enriched media for differentiation and fastidious bacteria. Again, you don't necessarily need to know the differences between these different culture medias. Just be aware that we use them to look at different growth factors and as the bacteria or the fungus grow, to determine if it's a positive result or not. Again, this is typically done now in a reference lab versus done in a general practice clinic. As a veterinary assistant, you absolutely, to preface this as well, you absolutely can go work in laboratories. After you get your CVA and you graduate, you can apply to work at veterinary reference labs if you like love processing samples and you want to do that. That absolutely is a job avenue post graduation. So with culture media, again, typically in the field, we're looking at fungal or yeast cultures. This is a hermaphrodite test media. So I am going to show you a quick video here about this test media. And before I do, I just want to show you, it's using these little circular discs with the blood agar that's on that will feed into that yeast or fungi, and then it will grow from there. Now this process, there's kind of a process of this, which is we collect the specimen, typically with a cotton tipped applicator. We do the direct gram stain of the specimen. We then inoculate that culture medium and we incubate it. And then we check for growth. And this is done every single day until we see growth, typically in between 7 to 14 days. Now, the one that we commonly do is one for ringworm. That's what we see all the time in the field. Ringworm is a fungal infection on the skin, and it's extremely contagious. We see it all the time. That would be the one that you would run in a clinic if they did have that available or if they did want to run that on site. So what we're looking at here is microbiologic stains. And before we actually kind of go through this really quick is let me show you what this culture media looks like it's called a DTM fungal growth culture of ringworm. So we'll watch through, it's a very short video just to show you what the growth can look like, and especially over that extended period of time, a week to 14 days, and what we're tracking when it comes to those culture medias. And this will be the last video for the section today.
Hi, I'm John Plan of Skin Vet Clinic. Dogs, cats, and especially kittens can get a skin disease called ringworm. Ringworm is a fungal infection of the skin and hair related to athlete's foot in people. It may cause circular lesions, from which it gets its name, but it usually looks different in dogs and cats. People can catch it from their pets. When we suspect that ringworm is a possibility, we will often perform a DTM fungal culture. The hair is inoculated into a special growth media with a color indicator. These time-lapsed images will show you what a positive ringworm culture looks like as it grows. Ringworm organisms utilize protein before carbs, which results in an early color change compared to other fungi. Here you see a DTM plate with the growth and color change characteristic of ringworm. It often takes 1 or 2 weeks for this to happen. At SkinVet, we will also confirm these findings with a microscopic examination of the fungal growth as shown here. The different species of ringworm can be identified based on the appearance of the culture plate and the microscopic characteristics. This is just one example of the expertise available at SkinVet Clinic.
All right, so that was it for that visual again of using that culture media for that ringworm DTM. So coming back into the slides here, we've only got a few more slides left until we're done with the section for today. Sometimes we do use stains that help us to be able to see what type of yeast or fungi is present. So for example, we could use acid-fast stains for Mycobacterium. We can use crystal violet or methylene blue if we're looking for yeast. Lactophenol, which is cotton blue for fungi, and other specialty stains as well. Again, depending on what specimen that we are looking for or that's suspected in that sample. Now, we also will inoculate the dermaphrodite test media. So this is when we place it into one of our cytology cotton-tipped applicator vials. This is if we're sending it off to the reference lab. So it'll go into like a sterile lubricant solution for transport. It also can be inoculated. This is also when we run it through a solution before we put it onto that culture media, just depending on, again, if we're running that test or what tests we are running. You're not going to be practicing this in lab, again, because it's very uncommon for you to be doing this in general practice, but still an important topic to talk about. Okay, into our last few subjects for today, we're looking at biochemical testing, such as catalase tests. These are performed on gram-positive cocci and small bacilli, which is types of bacteria. We use a reagent that's 3% hydrogen peroxide, and we use, when we're looking at this biochemical testing, we'll look at things like if it's catalase positive, that means that we're going to look at the enzyme catalase and hydrogen peroxide. If it yields water and oxygen, versus if oxygen gas bubbles are visible, that's going to be positive. If it's negative, then that means that no gas bubbles are produced. Again, with the immunologic testing, microbes can also be antigens. And it's important to note that immunologic tests can identify specific microbes. That's essentially the whole point of using those tests, as we've been talking about through the section today. So last subject that we're looking at here is antimicrobial sensitivity testing. This is bacterial samples that are isolated from the patient. We use them to determine effective antimicrobial treatment. So again, we'll do like a fresh culture. We'll perform it before the treatment's initiated, and the gram stain will determine which disc to use. We typically use an agar diffusion method, which will look for and measure areas around the disc that have no growth. So like I just showed you in that video of looking at the growth and tracking that. Be aware that cultures can be performed, especially again, when we're trying to determine what type of bacteria or yeast or fungi is present, in order to know how to effectively treat it. This is most commonly done with bacterial samples, especially if we, let's say like we had for example, UTIs, urinary tract infection. It's common that I've seen this happen quite a few times where patient came in for UTI, we determined that there was bacteria present, we treated with a general antibiotic, and it didn't do anything. The patient didn't improve. So that's at the point when then we would do a urine culture where they would incubate that sample and then they would determine what bacteria is present so that we know exactly what antibiotic to use to treat it. We don't typically run straight into using cultures because most broad spectrum antibiotics will treat, but in certain cases they don't, and we do have to do the culture. The reason that we don't jump straight to doing the culture is because it can take a week to 2 weeks to get the test result back, and they can be on the little bit of a pricey end. So, we do run a little bit of a gamble when we use broad spectrum antibiotics, but for the most part, they typically do work. This is just a image here of that culture media. And again, with some bacterial growth we see here, and you got to have a really good visual with that video. Last slide for today, we're right at slide 100, and we'll talk more about this subject when we come back into this lecture in the next section, is talking about quality control concerns. So again, remember, sample handling is so important. Using aseptic technique, being clean, sterile equipment, timing the sample collection and processing, labeling it correctly, staining it correctly, and using appropriate equipment and performing maintenance on that equipment to make sure that everything's in good working order. All right, students, that is everything for the section today. I'm going to end the recording now.